Recording in progress.
Hello and welcome, and thank you for joining us for the fifth and final session on our carbon footprint, climate change and sustainability series. I'm Linda Kruger, and I'm the local lead for the AARP Community Action Team here in Juneau. Angela Grantham from the Juneau Commission on Sustainability will be joining us later. We're wrapping up the series with a session on building resiliency. Climate change affects us all, physically, mentally, and emotionally. So what can we do to stay healthy and build community during times of anxiety-inducing change? We hope to get some answers tonight. I would like to start by acknowledging that the borough of Juneau is on the lands of the Klinedi and the Wishkitan of the Aquan and the Ishkitan of the Takuquan. These clans have been an integral part of the community's history, and because of their resilience, they continue to live on the land today. We're able to enjoy this beautiful place because of their wise stewardship practiced by the ancestors of these clans. We're grateful for their continuing stewardship and care. Gunishish. I'd also like to thank Lillian Petershore for her guidance and assistance with this acknowledgement. Gunishish, Lillian. AARP is the largest member organization in Alaska with over 75,000 members aged 50 and older. The AARP mission is to enrich quality of life and empower people to choose how they live as they age. With 38 million members nationwide, AARP advocates for and works to equip each individual to live their best life. AARP believes strongly in the principles of collective purpose, collective voice, and collective power of the 50+ population. Dr. Carolyn Brown brought the idea of this series to our Juneau AARP Community Action Team, and we agreed it was a good idea that fit with our mission. We contacted Juneau Commission on Sustainability member Steve Benke, who put us in touch with fellow member Angela Grantham, and we're on our way toward partnering in this series. Through this series, we hope to increase community engagement by presenting useful information and practical solutions that can be implemented by the community, family, and at the individual level. We hope these sessions empower people to take action in whatever ways are appropriate and feasible. We hope you will find something that works for you. May is Mental Health Awareness Month. Research has shown that raising our awareness and taking what we are seeing and experiencing and being proactive and taking even small actions to reduce our impacts is helpful in reducing anxiety and worry about climate change. We're hoping this series has been enlightening and has provided you with some steps you can take toward increasing sustainability and reducing your carbon footprint. One of AARP's focus areas is livable communities. Addressing the challenges of climate change and taking meaningful individual and collective action to reduce carbon are part of making our community more livable. Collective action is itself beneficial as social connection and shared purpose have been found to promote health and increase hope. With that, I'm going to move to our final speakers. Since both of our speakers live on the East Coast, I thought it prudent to ask them to pre-tape their presentation. We'll be hearing from Dr. Daniel Dodgen. Dr. Dodgen will go first, and he will introduce himself much better than I ever could. And Ms. Helga Luce will join him. Helga and I met virtually several years ago as classmates in a Yale School of Public Health graduate course on climate change and public health. She's a career communications expert with a specialty in health communication. There's so much more I could say about the two of them, but I'll leave it to them to introduce themselves and thank them both for sharing their time and expertise with us. Their pre-recorded comments will last about an hour and 20 minutes, and then Angela and I will be back with some closing comments. So stick with us. Thanks.
Did you pause the recording? Because I'm in it there.
Resume recording.
Let me see. That's what's playing.
Greetings. I believe it is evening in Alaska.
As we're recording this, it's afternoon in Washington,
You're sure it's
D.C.,
recording?
but it is
Yes,
such a
started to
delight to have
record.
the opportunity to talk with
I don't have
everybody
to.
about mental health and well-being in the context of climate change. This is such a huge issue, and I think one that really doesn't get paid attention to a lot. So we are delighted that Linda and all of her colleagues are interested in this topic and that you've invited us to come and talk about it. I'm Dan Dodgen. I work at the U.S. Department of Health and Human Services for the Assistant Secretary for Preparedness and Response. I also do a bunch of other things, as you can see on this slide. If you want to know more about me, we'll send you a bio separately so we don't waste time. I think the things that we want to talk about today are the equity, health, and climate nexus, which right now is really getting a lot of attention. And I think that this attention creates some unique opportunities for us to make real change. I think we're also going to talk about how climate change and extreme weather affect the health, mental health, and well-being of individuals and communities across the nation, how these threats have a unique impact on mental health, how their impact varies in different groups, and some things that we can do to mitigate. And my colleague Helga is going to introduce herself in a little bit, and she also has a lot of thoughts about particularly, I think, mitigation and building resilience. So it's, as we said, very, very much in the news right now, front page stuff, that climate change is affecting us all much more than we realize. For example, just a few months ago, EPA detailed all the ways that climate change will hit U.S. racial minorities the hardest. It's really quite extraordinary if you look at some of these data to see how low-income and Black residents in states that are particularly vulnerable in the South Gulf Coast, so these are primarily hurricane and flood damage. But if you look beyond this, you'll see also in Alaska, American Indians and Alaska Natives are 48% more likely to live in areas that will be inundated by flooding from sea level under that scenario. So we're talking about a lot of folks who are going to be particularly vulnerable and how that vulnerability is going to be disproportionate. And that's going to be a theme that we're going to hear throughout the day today, which is the impacts of climate change are profound, they're measurable, but they're also disproportionate. So there's good news, though. It isn't all bad. One example of a piece of good news is that relatively recently, less than a year ago, HHS, where I work, the Department of Health and Human Services, established an office on climate change and health equity. So we're actually starting to pull together people who will be focused on this and hopefully will be able to provide resources for people at the state and local level to think more about these issues. Some of you may also have seen the IPCC report that came out last summer. And this report, unfortunately, was not very encouraging. There really is a lot of reason, I think, to be concerned about climate change. As they said, it is code red for humans. What did they really say? Well, the IPCC, for those of you who don't know, is a United Nations body. It was established by the World Meteorological Organization and the United Nations Environmental Program to assess climate-related or science related to climate change. And in their latest report, they had a number of issues, including 5 takeaways, which are climate change is indisputably human cause, that 2010 through 2020 was the hottest decade in 125,000 years, if any of you can remember that long. Certain changes we've already seen are irreversible. Greenhouse gas emissions are the leading cause of climate change, and climate events are increasing in severity and number in every region of the planet. I think we all can particularly relate to that 5th one because we've seen such an outburst of not just hurricanes, but these rainstorms that hover over a community for a long time, wildfires, the melting of polar caps. All of these things are things that we see every day that tell us that these events are increasing in severity. Now, of course, it doesn't look the same everywhere. This is an important thing to remember because I think a lot of people, including friends and family members of mine, will say like, oh, well, it snowed here, last week. How can you say it's climate change when, things are colder than usual? Well, yes, it's true. With climate change, you might see colder weather than usual, but we have to be careful to remember that it's going to look different in different parts of the country, but that the overall trending is towards heat. So that even if you have these unusual winter events, that doesn't necessarily mean that climate change isn't real. In fact, one of the things you will see is if you look at this in the center part of the state, where cold waves have become less frequent and intense across the nation, but their tracks have shifted northward. So in other words, you might see cold waves in times of the year or in places that you didn't see it before. The same, for example, with extreme precipitation, where it may be places that always got rain, they're now getting it more in more intense storms. So you have these heavy downpours where you get a bunch of rain all at once, as opposed to spread out. And so you might say, oh, well, rainstorm, that is counter to climate change, but in fact, it often is evidence of it, even if it does produce lower temperatures for a very brief period of time. So that's the big picture. Hopefully, if I don't have to persuade everybody that climate change is real, but those are just some examples that I wanted to give to remind us that this is really a real and a very important thing. But the second and perhaps more important thing that I want to talk about today is that climate and health are inseparable. We often see sort of climate as one thing and then health and mental health as these separate things, but they're very, very inextricably linked. And this model, I think, which is from the health climate assessment that I'll give you a link for later on in the talk, this model, I think, really nicely illustrates how sort of the environmental context on the one side, so perhaps changes in land use policy or ecosystem, and then you see on the other side of your screen the social and behavioral context, right? So maybe changes in the way we do housing or education or all those other things, and of course ongoing issues around race, ethnicity, poverty, etc. Those things are already going on. But then in the middle of the screen, you see, oh, we have increased temperatures. Oh, we have precipitation extremes. We have extreme weather events, sea level rise. So now those are leading to poor air quality, reduced food and water quality, increases in infectious agents, population displacement. So you have these things, climate sort of coming down from above, if you look at the illustration here on your screen, and then these two other things impinging from either side. And that's what leads to the things in the bottom center of your screen, which is the heat-related illness, the cardiopulmonary illness, food, water, vector-borne disease, and of course, something that we're going to be spending quite a bit more time on today, the mental health consequences. Here's another model from the same document that I think also helps us to think about how this works. If you sort of think about the mental health, which is the stress, anxiety, depression, etc., as you see here, the medical and physical health, but then there's also the community health that's going to be impacted. And of course, all of us are people who have our mental health, physical health, and community health. It's part of how all of us are. And all of those things are going to be impacted by climate. Here are some key things when we start thinking about, so what are you, Dan, you've been saying there's mental health consequences. Well, what are they? Here's some of the examples. Post-traumatic stress disorder, depression, anxiety, grief, bereavement, increased substance abuse, suicidal thoughts. All of those have been shown by very good research to increase in weather-related disasters. So by this, I mean extreme weather events, flooding, hurricanes, tornadoes, things that are weather-related that we know are increasing as a result of climate change. And these are the consequences. It's also important to remember that disaster-related stress and accompanying psychological impacts can continue over extended periods of time. Because think about it, if you lose your home, or if you have to relocate, change jobs, or even just had a near-death experience because of maybe flooding, that's not something that you just get over immediately. So many of these things can last quite a while. Another thing that the science tells us is that there are specific groups of people who are at higher risk for mental health consequences from climate change. For example, children are at higher risk for distress, anxiety, other adverse mental health effects in the aftermath of an extreme event. Farmers, people with limited mobility, immigrants, those living in coastal areas, and those from indigenous communities or tribes, and veterans also experience higher levels of risk. Now let's break this down a little bit. Maybe it would be helpful just to think about it. People whose culture or job or livelihood are very connected to land, right? So people, perhaps migrant farm workers, indigenous communities, farmers, people living in coastal areas where there's a lot of, for example, boating or fishing or other things. So where your livelihood or your culture, or maybe just the way you prefer to live. I have a couple of brothers who live on the Oregon coast. It's beautiful. But I will tell you, the little bay where they live was just about destroyed when there was a tsunami in Japan after the whole earthquake and the event that caused the Fukushima disaster. So there are vulnerabilities when you live in coastal areas that put certain people at higher risk. Of course, those living in poverty with fewer socioeconomic resources are going to have more challenges because of lack of access to resources. And then the people who are responding, right? I imagine many people on this call might fall in this category. Firefighters, emergency medical service, healthcare providers. Also think of social service providers, and of course, people who work very closely, recovering human remains and other things. All of those folks may experience some risk as well. But what's another key finding? This one I think will be of particular interest to the folks from AARP, because probably the two groups that are most impacted by extreme heat are seniors and people with mental illness. And as it says here, increases in extreme heat increase the risk of disease and death for people with mental illness, including elderly populations and those taking prescription medications that impair the body's ability to regulate temperature. Well, we all know that people with mental illness or people with mental health challenges and seniors are two groups of people that take a lot of medications sometimes. And often the medications people take impair their body's ability to regulate temperature. But sometimes people don't realize how important it is when taking these medications to be hydrating. And I'll give you a really good example of the nexus of health, climate, and hydration right now. It's allergy season in Washington, D.C. And for those of you who have experienced allergy season in places with high pollen, it's pretty miserable. It used to be that I had to take, I use Allegra, not to endorse any particular product, but I used to have to take it, basically like for April. And then it was, April and May. And then it was mid-March, to mid-May. It's now end of February to sometimes the end of June, where I have to take medications every day. And I will tell you, even right now, giving this talk, I'm aware I'm dehydrated and I have to drink probably half again as much water every day just to sort of maintain, my normal functioning level. But often people don't sit down with those who are taking medications. I mean, the healthcare professionals sometimes don't take the time to sit down with people taking medications to remind them of how important it is to hydrate. So this is just an example of something that's fixable, but that is often overlooked. And it leads, as it says here, to the highest rates of death and disease during extreme heat events. Another thing that I wanted to talk about that I think we're becoming increasingly aware of recently is what we call threat anxiety. And that's just the fear of climate change in itself produces mental health consequences. So for people who are very sort of cognizant of the threat of climate change, people who perceive it, and often that's because maybe they live in an area that's experienced a lot of extreme weather events. There's different reasons that people have higher understanding or perception of the threat. Those folks are at higher risk as well, understandably, because they're really thinking about something that's a little bit scary. And of course, media and popular culture representations of all of these things have a big impact. One other thing that I wanted to mention related to how climate change threat can impact us is really in the area of sort of forced isolation, right? That as we have more frequent and prolonged heat waves, it may increase the amount of time that people have to spend indoors. I think we've all had a sample of what that can look like because of the isolation that we experienced during COVID. I myself actually did have the Omicron variant at the end of last year. And even though I had very mild symptoms because I had been vaccinated, I still had to isolate for 10 days once I was asymptomatic. And of course, it was very difficult. I am a person who gets a lot of exercise. I aim for 15,000 steps a day, and it's really hard to do 15,000 steps a day inside your home, no matter how much you pace on a conference call or whatever. So it was very difficult for me, and we can all imagine as things, as weather, extreme weather, particularly heat waves, increase, how that really can impact people, particularly children, and particularly people who are caring for small children to be stuck indoors all the time because it's too hot to go outside. So that's just another thing that we should be thinking about as we anticipate the long-term health and mental health consequences. Let me talk now a little bit about a couple of other bits of research that some of you may have seen. These are all pretty recent. They were in the news within the last year, so you might have seen them. But one is a more global focus. The things I've been talking about up to now have been more US-based research, but the Imperial College of London recently published a review paper that showed these rather remarkable findings that you see on the screen right now. The clear relationship between increased temperature and suicide, the clear evidence for severe distress following extreme weather, how people who meet criteria for mental illness are more vulnerable to the effects of climate change on physical and mental health, how climate crisis threatens to disrupt the provision of care for people with a mental health diagnosis, and how climate change exacerbates mental distress, particularly among young people, even for individuals who are not directly affected. I think all of these are very important, and I think as we think about the senior population that many of the people on this call serve, of course, we know that often seniors also have co-occurring depression, anxiety, stress, as do many adults in this country. It's not unique to seniors. But if you imagine the vulnerabilities for being senior combined with the vulnerabilities of perhaps having depression, anxiety, something else, and then these extreme weather events, you can see how you can potentially have cascading impacts. And I think that's very important to talk about, particularly when we think about how these could get worse without meaningful interventions, which is really the piece here. And hopefully something that we'll talk about as we proceed today and as Helga and I dialogue at the end of the talk, what are some things we can do at the community level to promote mitigation so that some of these consequences won't be as negative. So what are some of the populations of concern? I think first off, we always have to remember, where is a person? Because where you live, where you go to school, where you work, where you spend your leisure time, that has a huge impact on your exposure. Locations with greater health threats obviously include urban areas where there's airborne allergens and other air pollutants, communities experiencing depleted water supply. As a native Californian, we know how critical that is. And of course, vulnerable energy and transportation infrastructure, coastal and other flood-prone areas, locations affected by drought and wildfire. As big as Alaska is, I think almost all of these, there's some part of Alaska that experiences some of that. But of course, we know we have people in the audience that aren't just from Alaska, but are from all over the country. So I think you can all think about, in your community, who are the people that are going to be the most vulnerable? Children, of course, have unique vulnerability. But if we look down here, older adults also are not uniform in terms of their vulnerability. It's important to remember, you're not more vulnerable just because you're a senior. But how does that interact with these other things? For example, how does it impact with communities of color, with educational attainment, with socioeconomic status, with social support network, with physical and mental health, disability status, and of course, just your overall ability to access resources. Some of you who are in more rural states and communities, of course, know that accessing resources is a huge deal. I'll give you an example. My parents live on a ranch in New Mexico. The nearest hospital is about 45 miles away, but it is about a 5,000-foot drop in elevation from where they live to where the hospital is. That means in the winter, they may not be able to get to a hospital because there may not be passable roads, because there's just one lane each direction highway that actually goes through tunnels and curves around and drops several thousand feet of altitude in a very, very short amount of time. Not a road you want to be on if it hasn't been properly plowed or salted. So these are the kinds of things that we have to think about as we think about what happens in extreme weather for people who live in places where accessing resources then becomes a challenge. Of course, the social determinants of health, that's what we've kind of been talking about all along. People or communities have greater or lesser vulnerability depending on social, political, economic factors. That's what we call the social determinants of health. And you see some examples, the three elements of vulnerability by contributing to increased exposure, increased sensitivity, and reduced adaptive capacity. And I love this quote. I ran across this recently. Your zip code is a better predictor of your health than your genetic code. It's sad but true, and it speaks to how these social determinants of health really increase. And when we think of exposure, sensitivity, and adaptive capacity, I think we can all think of examples of that. If you live in a low-lying area that's subject to flooding, that means you're going to have increased exposure, right? If you also happen to have mold allergies, okay, now you've got increased sensitivity. And if you have either limited internal capacity, maybe you have dementia or something like that that makes it hard for you to access resources, or maybe you just don't have resource, you don't have the financial ability, that's going to limit your adaptive capacity. So that's how these things merge with these social determinants of health to determine these things. So how does all this fit together then with resilience, right? Because we want to have a positive, like how do we help make our communities more resilient? Well, one of the things I think that's important to remember is there are lots of aspects of community resilience. And the CHR that's referenced in this document refers to community health resilience. And as you see here, there's lots of things. It's about helping people face everyday challenges as well as extreme events. It happens at the community level. Government efforts are required. But if you look at the bottom of this, it's important to understand how health underpins all these other things, because the health system is an infrastructure system, right? The healthcare system is an infrastructure, right? We have hospitals, we have ambulances. It's also part of the sort of basic infrastructure in terms of electricity and access to power, access to water. All of those things connect at the health center. And then, of course, you have how communities function and who's in your community and who are the most vulnerable people. So health and mental health intersect with all of these other aspects of community resilience, but often forgotten when a community starts to develop a resilience plan or an emergency preparedness plan. They forget how health connects to all of these other things. So the first thing I would say when we think about developing resilience, developing community resilience, it's how can we keep health at the center? Health and human well-being. So we've talked a lot about a number of different things today, how climate change and extreme weather affects health, mental health, and well-being of individuals and communities across the nation. We've talked about how these threats have a unique impact on mental health, how they can have different impacts on different groups, and how we can mitigate the impact by creating a culture of resilience. I wanted to lead you to a couple of different reports that might help you if you want more information. The USGCRP, that stands for United States Global Change Research Program. If you look at the bottom of the image on your screen, it's also spelled out there. The Health 2016, which is this report on the impact of climate change on human health, is very good. It will give you a lot of information. If you go to the USGCRP website, you will also see information about the National Climate Assessment, which is done approximately every 4 years and covers the full range of everything we know about climate change in the US as of the time of the writing of that report. The last one came out in 2018. We are working on the next one right now. I think it'll probably be out in 23. So there's exciting information at this USGCRP or globalchange.gov website. I also did want to say that we've developed a couple of new advisory groups at my agency, the Assistant Secretary for Prepared Response, specifically around disasters and seniors. And also we have one on a National Advisory Committee on people with disabilities in disasters. So those also are folks that over time are going to be generating recommendations about ways to address it. I've put the URL here on the left of your screen, but you can also just Google ASPR advisory committees or something like that, and that will also get you to these web pages. But the URL is here if folks want it. This group literally just met for the first time within the last couple of months. They just elected their chair this week, so they're just now starting. So there won't be a lot of content yet because they're just starting their work, but I think over the next couple of years, you're going to be seeing a lot of information coming out from them.
Hi, everyone. I am Helga Lust. I'm a senior director at Manhattan Strategy Group, a government contracting firm here in Maryland. And I am a climate activist in my free time. So I spend a lot of time doing research and learning about climate change and really thinking about social behavior change with regard to climate change and how to move our communities along a little bit faster to reduce carbon to prevent the worst effects of climate change. So I have a few slides to share with you all. I'm going to go ahead and share my screen. Okay, so I'm going to touch on the resilience more. I know Dan already gave you all a great overview of climate change and health. So we'll just get right into the presentation. If I can get the slides to move. Here we go. The first slide here, I just wanted to share because back in 2018, we heard from the IPCC, the Intergovernmental Panel on Climate Change, that we have 10 years to reduce carbon to the point where we can avoid the worst of global warming. And I wanted just to show this picture of me with my twins when they were little in 2009. And then in 2019, 10 years later, you can see 10 years is not a lot of time, and we have no time to waste. So the next image here is of my backyard. We had a microburst storm back in 2019. And in a matter of maybe 10 minutes, close to 20 trees came down in my backyard. And when I walked outside, all I could do was sob because my backyard is my sanctuary. And I spent a lot of time nurturing the trees and the plants and the flowers and the herbs. And there was so much destruction. Even my she shed was impaled by one of the trees. I, at that point, called this experience garden grief, my own term to try and put some kind of description on what I was feeling in that moment when there was so much destruction to the nature in my backyard. So let's talk a little bit about why this matters. These microburst storms, these, what else are we calling them? Bomb cyclones. We are having a new vocabulary when it comes to climate change because of these experiences. So CO2 is being released into the atmosphere faster than at any time in at least the last 66 million years. 19 of the 20 hottest years on record have occurred since the year 2002. So that's more than weather. That's a very serious warming trend. And the hottest of all have been the last 7 years, although it should be, because we're now in 2022, it should be the last 8 years because 2021 would be up there as well. So warmer air can hold a lot more water vapor, and that's where these microburst storms and these bomb cyclones and flood events are happening. With each additional 1 degree Celsius of temperature rise, the atmosphere's capacity to hold water vapor increases by 7%. So that's a lot more moisture. So as we warm, there's more water vapor in the atmosphere, and then that factors into weather and, even changing things like our jet stream, the polar vortex in the winter, that all has an impact. There's already 5% more water vapor over the oceans than there was only 30 years ago. So the downpours get bigger, which is what I was just saying, and that's an image here of a bomb cyclone. and global record-breaking precipitation anomalies. If you look at this, I mean, the dramatic increase towards the end of the 2010s, and we're still seeing that globally increase. This is a video of Ellicott City, Maryland. They had two 1,000-year events, flood events, in 2016 and 2018. So worldwide extreme weather catastrophes are definitely on the rise and have been for some time. These are just some of the types of infrastructure at risk. So there are a host of infrastructure components that are at risk from these extreme weather events and floods. And the impact, so let's talk about what happens when we have these disasters and these extreme weather events. It has an effect on mental health. It has an effect on individuals and relationships. And so we see that trust is affected, feelings of safety are definitely affected, feelings of hopelessness and helplessness, the powerlessness that people feel in the aftermath of something they have no control over, feelings of shame, guilt, rage, and self-hatred. And then there's a result of isolation and disconnection from others and from the world, a disengagement. Natural and man-made disasters make it very hard to hope and see a future or to plan for that future. And many of us today are struggling with the pandemic, the climate crisis, and structural racism as well. So how does climate change affect health? Well, you can see there are so many different ways here: infectious disease, water and access to water, mental health, allergens, heat stress, air pollution, food and food accessibility, and extreme weather events. And they're all interconnected. The mental health impacts of climate change are also significant. So we know that climate change and heat in the warmer months of the year, there's an increase in violence that can affect mood. We know from studies on school-age students that when there's warmer weather, it affects cognition. Also in the workplace, it can increase instances of insomnia. And then medication effectiveness and the need to hydrate more when there are heat events. So the cost of carbon, there's just so much here. The cost of carbon is really astounding, and economically, this will affect every country in the world. And the number one threat to the global economy is climate change. So, but we do have the solutions at hand, thankfully. Carbon reduction, smart policies, collective action, people really working together to reduce their carbon footprint and affect their community's imprint. Using a health frame. All of the recommendations that we see coming out, whether it's transportation, adaptation, sequestration, buildings, energy, all of them have health co-benefits, every single one of them. So using a health frame will be really helpful. And I bring this up because for decades, we've been focused on the environmental frame and the science frame. And those frames have not moved communities to climate action, but the health frame and not only realizing the health benefits that could come from certain shifts that we make today, but also the health frame that will create or hopefully reverse some of the negative effects so that our children and grandchildren have a livable planet, that we have that we're doing everything we can to leave a livable planet for future generations. Intentional community connectedness is really important for resilience and for our climate solution, because in an extreme weather event, we are each other's first responders. So having that intentional community connectedness and knowing each other before an event happens is really important. And then lastly, preserving biodiversity and realizing that our planet is really suffering. We are not the only living beings suffering because of global warming, but we are the ones that are responsible for the warming that is happening. So preserving biodiversity and other life on this planet is also very important. I just wanted to cover very briefly here the types of resilience. The first 2 points being reactive and the second 2 points being proactive. So resilience as resistance, that's kind of holding the line. I think, an example would be people in Miami building a retention wall and hoping that that's going to keep the water out of the coastal apartments. That's reactive and it's really unrealistic. We can't stop Mother Earth. If the sea level is rising, the water will come. The second point here is resilience as a bounce back, getting back to normal. That's, not really taking in the full impact and effect of the event that just has happened and the likelihood of recurrence, but it's just kind of cleaning up and getting back to normal, reactive. And then the next point is resilience as adaptation. So adjusting to a new normal. And adaptation for Miami, rather than, I guess, building a wall could be considered an adaptation, a short-term adaptation to try to keep water out, but a more realistic and maybe cost-effective adaptation would be moving inland a little bit, moving away from the coast when the water is pushing in. And then the last point is resilience as transformation, owning the need to change. So transforming, thinking through everything from how we live, how we work, where we work, what we need to change in our daily activities that will bring about transformation that leads to the kind of growth that supports long-term resilience. And the attributes of resilience are being self-aware, realistic, staying calm under stress, having empathy for others, self-control, motivation, staying optimistic, and having a shatterproof set of beliefs. I wanted just to share this URL with you all. If you have a few moments, this is a YouTube channel that I started as part of my advocacy work. Give a Shift is just the YouTube channel. They're short videos, usually 3 minutes or less, on little shifts you can make in your behavior every day to lessen your carbon footprint and help to address climate change. And we have our tagline at the end of every episode is, I give a shift, and I hope you will too, because if we all give little shifts, they add up, and they do. I also wanted to mention there are some great social media groups you might want to check out. One is on Facebook, and it's called Climate Change and Health. I facilitate that one. And then on LinkedIn, there is Climate Reality, also great content, latest research, great social perspectives on climate change and collective action. And here's my contact information in the event that you want to reach out, or if you have any questions, feel free to be in touch. Thank you so much for the opportunity to share my presentation and to share my thoughts with you. Very thankful that you all are focusing on climate change. And if there's anything I can do further to be helpful to your group, feel free to reach out. Thank you so much.
And I'm going to stop now. We're not going to be able to have the kind of discussion that we'd normally have since this is being taped in advance. But Helga and I are going to do our best to interact a little bit around some of these issues and hopefully address some of the questions that have been occurring to you while you've been listening. So thank you for your attention. And now we're going to continue the conversation.
All right, so we'll get to some of these questions here and hopefully dispel some myths and provide a little additional information. First question, Dan, is what are the immediate challenges or barriers to addressing climate change?
I think this is a really, really great question. And of course, as we know, there are a lot of barriers. I think it's too easy just to say someone's a climate denier or, you know, someone is just doesn't like science. I don't think that's respectful, right? I think people, for whatever reason, have concerns. It may be, like we talked about earlier today, it may be because you actually experienced a lot of snowfall in, you know, where you live last winter, and so it's hard to believe that there's climate change. It may be that the language of human-caused change sort of feels very blaming, and sometimes it's just the sense of it's a bit overwhelming, right? I mean, you know, we talked about climate anxiety, like to think that the whole world is changing in this relatively rapid way, and it's going to impact all of us, is very overwhelming. So I think first off, we can't just assume that anyone who struggles with doing something about climate or accepting climate change is just a denier or is anti-science. I don't think that's helpful for having the dialogue. So I think, but I do think the barriers are real in terms of people not being sure what to do, feeling a little bit overwhelmed by everything, certainly getting mixed messages depending on what your news sources are can be very confusing, right? It's a complex topic, but I think on the day-to-day level, the barriers really are about sort of seeing what you yourself can actually do to make a difference so that it isn't overwhelming. But I'd love to hear your thoughts on this, Helga, because you've actually given a lot of thought to this.
I think a bit more at a macro level. Of course, I think every person should look at their carbon footprint and think about little things they can do every day, like line drying your clothes instead of putting them in the dryer, washing your clothes in cold water so you're reducing your energy use. Like these are simple little things, but they add up over time. I do think, though, that one of our biggest challenges is how politicized climate change has become in recent years. And while I think there is significant acknowledgement that climate change is happening and people are noticing the severe weather events, the fastest way to get us to reduce carbon at the levels that we would need to really prevent the worst disasters, is through policy. And unless we have collaboration among our political electeds to work on this together, this is not a political issue. It's a human issue. It's more than a human issue. It's all the biodiversity that's being impacted, all life on our planet that's being impacted because of what humans are emitting from fossil fuels. So I think it's one of our biggest social challenges. But, we did in 10 years, we know we have less than 10 years to try to reduce carbon to the level to avoid the worst warming, right? In the turn of the last century, over the course of 10 years, we went from horse-drawn carriages to everyone driving cars. So when it comes to converting to green energy sources, we can do it. We know even from COVID, a quick example, but we know from COVID when everything was locked down for weeks, within 3 weeks, our carbon reduced by more than 20%. So we have the ability to do it. It's having the will and the leadership to get there, I think.
Yeah, I really appreciate you saying that. And certainly in my comments, I was not implying that there aren't political and policy issues, but also just reminding us to try to have respectful dialogues about this topic because it is a bit overwhelming. And certainly there are industries that will have to change and adjust. And people whose jobs are dependent on those industries, I think their anxiety is reasonable. But I think you've just said something really important, which is we can shift, right? I mean, I am a huge car guy. I love old cars. And of course, the cars I love the best are probably the worst for the environment because they're the really old, the old muscle cars, et cetera. But when you look at what's happening in the auto industry right now with the really massive commitment, I mean, what GM is really, making huge commitments. Ford, the new F-150, that's like the best-selling vehicle in the country. That's a monster truck, right? But they have a new electronic version. Like, it is amazing how fast these industries and how much people are actually embracing them. And I think as the technology for recharging gets better and the systems get more uniform, the electric vehicles are going to become more and more practical. I think it's a really good example of what you're talking about, which is once the technology is adapted, how fast it can move and how the folks who thought the change would be a threat to their livelihood, it may not be, because the auto industry isn't going anywhere. It's just changing the way it does business. And I think that's a lot of the resistance that maybe can be overcome as the technology enables us to overcome it.
Absolutely. Let's go on to the next question. So what are the lessons learned from the pandemic that we can apply to climate change?
This is such a great question, and I hope everyone in the audience has really been thinking about this, because I think Helga's just given us a great example, which is how we learned not to drive everywhere and to reduce our carbon footprint in that way. And of course, also we talked about sort of the downside, right? We learned, the upside is we learned we can telework successfully, which means people don't have to commute as much, which will have a positive impact on emissions. Also, though, there is the potential downside, as we talked about. We learned in COVID that even though we're at home all the time, we still need to get outside, get exercise, interact with other people. So it tells us that we need to take advantage of all the wonderful new technology that we've now, well, it's not all new technology, but we're newly adopting it, about using Zoom calls and conference calls. And even, Helga and I right now talking to everybody pre-recording. I'm not sure we would have done it this way 2 or 3 years ago. We might have just said, we can't fly out to Alaska, but we'll try and find you, someone else who can talk to. But now we're much more comfortable with these technologies. And I think COVID has helped us learn that we don't have to do business the way we've always done business, that we can work differently, we can meet differently, and all of those things are ways that can reduce carbon emissions. But at the same time, we've also learned that we do still need to connect, we do still need to get outdoors, that we can't just become hermits in our homes, because that has other negative health and mental health consequences. But Helga, I'd love to hear your thoughts. Again, I know this is something that you've been thinking about a lot.
Yeah, I think there are a few things that I think about when it comes to COVID. In the early days, I kept thinking, here's, we're trying to flatten the curve. That's exactly what we're trying to do with climate change, right? We're seeing, the warming, and we haven't hit the peak yet. And but this is another really important curve that we absolutely need to flatten. Also, the importance of the air we breathe. It's so directly related to climate change and environmental justice. And here, when you have a pandemic, you have to be really cognizant of the air you're breathing and realizing that there are things you can't see that you could take in that could be detrimental to your health. The last point that I wanted to make was just what we've seen with nurses. We know that the frontline workers were really impacted, just tremendous amount of stress, long hours, tremendous grief, angry families who couldn't be with their loved ones. And what we've seen from the early research is that the older experienced nurses are more resilient because they've had perspective and experience and ability to manage a bit better. The younger career or early career nurses and traveling nurses have fared the worst. They have the highest attrition rates. They have the highest suicide attempt rates. And it's likely because of that lack of experience. So I think there's also sort of a good learning opportunity there for us to realize that people who've been around the block a few times, we're not, like 5 years out of college, just like getting our feet wet. But once you've experienced some life and have a good perspective and experience from your work, that there's a lot we can share with the younger generations to help them manage and keep perspective, and staying connected, I think, is just really critical.
Those are really wonderful points.
All right, next question. How vulnerable is Alaska to climate change?
This is a great question, and it's not an easy one to answer. One of the things that makes Alaska, and I confess, it's one of only 2 states in the union I've never been to, so I look forward to getting out there very soon. But one of the things that I know about Alaska, because I do have several friends from there, is it's a really diverse state. So it's hard to make a single comment about what is Alaska most vulnerable to, because it is so big and so diverse, but diverse geographically and in so many other ways. I mean, it's 2 time zones, right? But I think one of the things that we ought to be thinking about is, first off, sea level rise and how that's going to be impacting. And we certainly know that in many parts of the country, coastal communities who are vulnerable to sea level rise are experiencing a lot of challenges, needing to retrofit, and in some cases needing to actually relocate. We've had tribal communities in the Pacific Northwest and actually in the Gulf Coast, and other communities that have had to relocate because of sea level rise. They literally could not stay in their traditional homes anymore. So that's certainly something that we need to be thinking about, is what's the impact of sea level rise going to be on all the coastal communities in Alaska, particularly tribal communities who are very, very connected to the land. I will also say, remember when I was talking about GCRP, the Global Change Research Program, that national climate assessment that we do technically every 4 years, but it's probably more like every 5 years, because it's a very, very robust process of getting it done. It actually has regional chapters in it, and I would really encourage, particularly the folks from Alaska, but everyone who's listening today, like, take a look at that document and just read the chapter on your region, and it will provide a very, very nice overview of what the unique risks are, what the challenges are, and not just in health, but also in other areas too, in terms of predicting what the weather changes are going to look like, predicting the influence on agriculture, influence on infrastructure. So not just health, but there's really good information in there, and I would encourage folks to look at that, not just for Alaska, but for anywhere, as a way to get a kind of a regional snapshot of what are the risks and what's the current status of the science in your area. Helga, what do you think?
Well, so I am really fascinated with permafrost, because it seems like there's a lot locked in permafrost that we don't yet know about. And I wonder about the potential health risks of, biological agents, whatever, being exposed over time as permafrost melts. And then also the factor of methane release from permafrost melt, which tends to have an even more warming effect than carbon. So those are a couple of things, but I know for Alaska in particular, infrastructure is always noted as one of the most at risk areas of just everyday life and what people should be thinking about. So that's largely from erosion and flooding, but yeah, that's there's a lot to think about in that big state.
Yeah.
All right, last question here. What are some of the unique strengths of older adults?
Oh, that is just such a great question, because I think so often we put people into categories and say that they're vulnerable without recognizing that whatever it is that makes you vulnerable may also have been something that helped you to be resilient. And certainly a lot of seniors are resilient just because they've lived a long time and they've seen a lot. And certainly we've seen in the past that seniors sometimes are actually at lower risk for mental health consequences of disasters like hurricanes, floods, tornadoes, these weather-related events, because they've been through it before and they kind of know how to prepare, they know how to handle it, and they know how to sort of fit it into their view, right? Because they've seen it before. They can say, oh, this is worse than the storm of 2001, but not as bad as the one from 1992 or whatever. And I think it gives a perspective that is very strengthening. The challenge, of course, is in very extreme events, people feel like, I've lived through 20 hurricanes, I know what to do, but maybe this 21st one is quite a bit worse than the others, and that may make you reluctant to evacuate or to follow guidance because you feel like you already know what to do and you've been through it all. So there can be a downside to the experience of having lived through these kind of events before. But in general, it's strengthening. I think another thing in many communities, there's very strong social support systems for seniors. There's a community center, a senior center, something like that, that people are connected to. Very often there are well-established social networks so that you have people, if you need assistance, people that you can call on. Again, the downside of that is seniors sometimes are not as savvy about new technology. And so I think planners and people that work with seniors have to really be very attentive to helping seniors, understand how they can use technology to access help in a disaster. I love to use personal examples of this. So I'll give a personal example. In my family, my stepmother, who is a smart, independent, lovely person from the Northwest, who hates carrying phones with her when she's hiking because she worries that it'll fall out of her pocket or something will happen to the phone. So she never takes her phone with her when she's hiking. Well, remember, I already told you that they live at a ranch that's at over between 8,000 and 9,000 feet elevation in remote New Mexico. Now, they're great hikers, so not a problem. But if you should fall and twist your ankle or whatever hiking at that kind of altitude, wouldn't it be nice to have a phone on you so that you could call for assistance? So we are working now to develop the habit of just carrying your phone with you and setting it up so that you can do an emergency call to a family member or to 911. It's a simple example, but I think it's an example of how this greater experience in independence is really wonderful and gives you strength and gives you resilience in your mental health. But on the other hand, there are certain risk factors that we need to think about too as seniors, so that they're not allowed to be isolated by unfamiliarity with technology or by sort of thinking that their own experiences prepared them for anything that might come in the future. Helga, I know this is a topic close to you, just anything that builds resilience in communities. I'd love to hear your thoughts on this.
Yeah, thanks. Not surprisingly, we have some overlap. So when I wrote these down before because I really wanted to be kind of thoughtful and really thinking about this certain strengths that people have as they age. And the long view perspective that you were talking about, that was number one on my list, like realizing you have a whole longevity, a whole lifespan of memories and benchmarks and experiences that you learn from. And so having that long view perspective also gives you the forward thinking perspective of knowing even if this is a really bad weather event, we'll recover, we'll be okay, There's also this kind of attitude of don't worry, prepare, right? Like mobilizing before the storm comes and prepare adequately so that the impact is not so bad. There's also the spirit of generosity. And I see that with neighbors, that helping other neighbors and people helping and offering to help is a great way to not only stay connected and talk through sort of the shock of what's happened, but also gives you a feeling of giving back and purpose in a time that, you know, that may be a little uncertain. Enjoying small daily pleasures. I have a neighbor in my neighborhood here who I watch her walk down the street every day, and she stops and smells the flowers, or will watch the bee, you know, pollinating. And it's those little moments, I think, are really important to realize, you know, and stay connected with our beautiful world. And then the last point, which also was an overlap with yours, is just the importance of staying connected and expanding the social circle, especially if you start to feel passionate about climate change. There are a lot of advocacy groups and some that meet online, but having those conversations and learning more about how you can get involved, either through advocacy or volunteering or reading clubs, there are just lots of ways to be involved.
Those are really great ideas. I hope that folks listening have the opportunity to follow up, because there, as you said, there are some amazing community activities, and a lot of communities do actually have planning organizations, right, who think about what are the disasters and risks that our community is facing and how do we plan for them. So I think a great way for seniors to potentially get involved and lend their wisdom to those who are doing some of this planning.
Great. Well, Dan, do you have any closing thoughts?
You know, so two of the questions that we often ask ourselves, and you know, and I thought I might throw out, one is really, what are the things that you worry most about when you think about climate change and the senior community? And then what is the thing that you're most optimistic about? I'll start so that you have a second to think about those things. I think if there's one thing that I do feel like we should be really thinking about, it's this higher mortality and morbidity in heat waves, because I think it's addressable. This is actually a pretty fixable solution. Communities can set up cooling stations. Physicians and pharmacists can talk to people about hydration when they're taking medications that you know, that affect temperature regulation, like, and maybe it's PSAs. But I think it's, so it worries me, but I think it's also something that we can actually do something about. And it's so nice to have things that we can do something about. So that's, I think, a worry, but a worry that is addressable. And I think, again, particularly seniors are very vulnerable in this area. And then I think the thing that gives me optimism is that I feel like we've moved to a different place in the last 2 years in talking about climate change. I feel like we've kind of moved past the, is it real, is it not real, and moved more towards, okay, something is going on. And regardless of your thoughts about, you know, sort of how much is human caused and how much is this or that, things are getting warmer. Extreme events are happening, wildfires, whatever. And so to me, I feel like we're at a place where we can maybe start to put aside some of the political controversy that can never be put aside because we live in a political world, and start to just be pragmatic about, okay, well, you know, the sea level's rising, what are we going to do about it? Or, you know, the permafrost is melting, what are we going to do about it? Or whatever. And I think we're at a place now where we're starting to have some of those more pragmatic conversations, and that does give me optimism, because I think if we can keep it pragmatic, maybe we can stay away from some of the controversy and just be like, okay, let's just solve this problem right in front of us. Because I think that we are a very ingenious people, Americans, and of course people all over the world can be ingenious too. And when I look at what's happened in the car industry in the last 10 years or so, embracing electric vehicles, when you look at the way we all recycle now, I mean, when I was a kid, we threw everything away, right? I mean, we are making changes, and that gives me optimism about our continued ability to make change, because we clearly are already making changes.
Those are great points, Dan. I think what I worry about most at this point is just the impact that COVID has had on so many aging adults, that they're still remaining pretty isolated, and that worries me with regard to climate change, because the more disconnected we become, and the more isolated we are, the less engaged and energized and able we are really to to be part of the solution, or to be engaged in groups that are working on a solution. So that's probably my biggest worry. The optimism comes from the connection that our older generation has with the younger generation. It's, the folks in the middle that are really not doing as much. I mean, you and I maybe, but, it's, the climate strikes, and you've seen over the past couple of years, the youth movement just completely mobilize, walking out of school, striking, and, really trying to get the attention of policymakers and other adults to pay attention, and realizing that this could affect their future. And the beautiful thing, and this also goes back to indigenous culture and belief, but grandparents have a lot of wisdom to share. And when you can pair that with youth energy and the wisdom of their grandparents or their ancestors, I think there's a lot of magic that can happen. A lot of really great things can happen when you bring the groups together. And Jane Fonda started joining the climate strikes here in Washington. It's people are recognizing and wanting to get more involved, and I think it's really helpful to have celebrities also involved, speaking out and investing their own resources and and money in trying to make a difference, and planting trees and doing other things. So I think there's a lot of opportunity there, and hopefully healing moments for families as well.
This is great. What a pleasure it's been to talk with you about this. I am sorry that we can't be in person with all of the folks who are online, because I'm sure that you all are having so many thoughts about this. But we'll leave it to Linda to help you to figure out what's the best way to comment, ask questions, and interact with one another on these important topics. And I'm sure that she will do that. So thank you so much for your time and attention. Thank you, Helga. What a pleasure it's been to have this conversation with you.
Okay, I just want to say thanks again to Dr. Dan Dodgen and Helga for their terrific presentation. And thank you to all of the presenters and organizers who have helped us throughout this entire series. It's been amazing. Thanks to you for joining us either during the live broadcasts or the viewing of the recordings later. And I'll just give you a reminder that recordings of all of the sessions are available to watch on the AARP Alaska webpage at https://states, states.aarp.org/Alaska. If you have problems finding them, reach out to me. Most of you know how to get a hold of me. And Jolie, I'm going to turn it over to you.
Great, thank you, Linda. Okay, let me share my screen. Okay. So we have been together now for a couple of months. This is the 5th session in this series. And after hearing from all of these wonderful presenters, we've really seen this vision for what our future can look like and what the future of Juneau can look like. And I wanted to end by providing some additional resources for you all so that you can continue to stay engaged and turn all of this information into action. Because as you know, and as we've said over and over again in this series, we are really solution oriented and want to empower folks with the information that we've provided to you. So here you can see, and on the next slide, you'll see some resources and some advocacy priorities to consider moving forward. After the first session was about our carbon footprints and about the Juneau renewable energy strategy, we then moved on to looking at how buildings are a climate change solution. And if you recall, a good portion of Juneau's greenhouse gases come from the heating of our buildings because we often will use fuel oil to heat. So air source heat pumps are an excellent climate change solution. Also, as the cost of fuel goes up and the cost of electricity remains stable here in Juneau, there's a major financial incentives for heat pump adoption. Learn more about heat pumps with Alaska Heat Smart. They will set you up. They'll come and do an assessment of your home. They will help you to decide which configuration makes most sense. True North Federal Credit Union even has a heat pump home loan that you can acquire to install these heat pumps. Thinking about energy conservation, when things are in need of being replaced in your household, opt for the energy efficient options like Energy Star appliances. Remember that there's considerable energy savings and money savings that can be accrued just by turning down your heat by 1 or 2 degrees. So there's all sorts of ways where you can make home energy efficiency improvement, simple things from, just turning down the thermostat to improving caulking. The Juneau Carbon Offset Fund is a local program where you are able to purchase carbon offsets that then go to fund the installation of air source heat pumps in the homes of lower income Juneau residents. And so this is a wonderful way to spread this climate solution and address equity in the community, all while addressing our own personal carbon footprints. And in general, thinking about other advocacy priorities, it's all about heat pumps, trying to get those in as many buildings as we can, and then continuing to work and pressure utilities to boost the amount of renewable energy that's available. And in Juneau, that's boosting the availability of renewable hydropower so that we have the energy that we need in order to fulfill our clean energy goals. Thinking of transportation, it's all about also the electrification of transportation, beneficial electrification of the transportation sector. The Alaska Electric Vehicle Association does excellent advocacy. They're engaged with the Regulatory Commission of Alaska and doing all this technical stuff that most of us is like just totally beyond us. However, they're doing the good work for those of us in Alaska who are working to expand EV charging infrastructure and EV adoption. The Juneau Electric Vehicle Association installs public chargers here in Juneau. They have fun events throughout the year. Capital Transit, public transportation is a climate change solution. The more we're using public transportation instead of driving our personal vehicles, the fewer emissions result. And we are continuously working to advocate for dock electrification so that when cruise ships come to Juneau, they're able to plug into shore power, no longer emitting the pollution that they do, and then also burning that fuel that they do. So dock electrification is a major advocacy priority in this community. We're continuing to work on trying to find ways to install more EV charging stations, especially for those that don't happen to have a driveway or a parking or a garage, so that more folks, regardless of their housing situation, can access EV charging stations. And there's lots of opportunities for expanding bike paths and other non-motorized transportation options. We had this really fun food and waste session, Grubbing Garbage, where we talked about the benefits of a local circular economy, considering food waste as a resource, not as garbage. Composting is a wonderful solution for keeping resources local. Composting also reduces the production of methane, a harmful greenhouse gas, when done correctly. Food waste reduction is a major way to reduce an individual's climate footprint, because if food waste were a country, it would be the third largest emitter of greenhouse gas emissions. So everything that we can do to honor the food that we harvest ourselves or purchase by using it entirely is great. And what we don't use, compost. There's options for community gardens in Juneau. Hopefully there's one in your neighborhood. Maybe you can join if you haven't already. And at the assembly level, the assembly is looking at zero waste planning. Nationally, there's greater pressure on those who produce plastics to be responsible for the disposal and recycling of those plastics. And that's probably our best bet for reducing plastic pollution. Plastic, of course, is made from fossil fuels. And so it is directly related to the climate crisis. And then whatever we can do to enhance local food security through circular economies is great work. Today we heard about health and resiliency and the many ways that we are affected by climate change in the nation, but a lot of the things that were spoken about fit so well to the situation of Alaska. Us who live are so close to the wild, we live within it. We are subsistence peoples, and our connection to this land is really great, making it so that we're more susceptible to mental health crises as we watch this land change from the climate crisis. So there are great local resources if you are suffering from climate change anxiety or mental health issues related to this. A lot of them are listed at juneaumentalhealth.org. And as we've said before, working with and through community on changes is a great way to, enhance our own resilience, our community's resilience, and grow our own hope, because action helps us to be more hopeful. And then finally, on the right there, you'll see a list of resources and organizations to keep involved with. 350 Juneau does a lot of advocacy. Southeast Alaska, the SEAC, has a new Southeast Alaska Climate Report, which is a newsletter that you can subscribe to. Renewable Juneau does all sorts of advocacy related to boosting renewable energy in Juneau and the clean energy transition here locally. Interfaith Power and Light is a consortium of different religious organizations working on clean energy issues here in Alaska. And the Juneau Commission on Sustainability is about ready to drop a new upcoming report on Juneau climate change impacts, which has been done by the University of Alaska Southeast. So stay tuned for this upcoming report on the different impacts that Juneau is experiencing and can expect from climate change. That's all to share at this moment, but I too just want to thank everyone who's participated and who's viewed. Really want to thank AARP for partnering with us on this. It's fabulous to be able to connect and to reach different audiences and to amplify all of these solutions that currently exist for us to start to tackle climate change. So thank you, Linda.
Thank you, and Julie, and thanks to the Commission on Sustainability for partnering in this. It's been wonderful. Thanks to all the speakers who helped us out. This has been a terrific series, and all the people who have joined us online, on the Zooms, on the Facebook page, on the looking at this afterwards, later at the AARP website. I think one of the things we heard tonight is the climate emergency is hurting because we love this place we live. We love the earth, we love our community, and we all want to do what we can to help it survive as long as possible. So I hope you've learned some things throughout the series that you can implement, and we appreciate your participation. And thanks, Anjali. Thanks so much. Take care.
Thank you.